Okay, we are done with the three steps earlier on, which is the synthesis, purifications, and formulation. For this part, which is dosage form preparation, before the FDA approval, a company must clearly state in what forms of the drug will be manufactured, either it's solid, liquid, or semi. Company must also clearly state what routes of administrations uh, de- are to be consumed. This determine the safety and the effectiveness of the medicine. The formulated preparation is made into its final form. The final form is dispensed into container. The container are labeled and packaged. So the definition, the dosage forms are the means by which drug molecules are delivered to the sites of action within the body. The need for dosage forms is number one, accurate dose. Number two, you need the protection. Number three, masking, taste, and order. Placement of drugs or drug delivery, sustained or controlled release medication, optimum drug action, insertions of drugs into body cavities, or the use of desired vehicle for insoluble drugs. So why we should be familiar with the basic properties of dosage form. Basically, it will provide the mechanism for safe and convenient delivery of accurate dosage. That is the first reason or importance. Then protect the drug substance from destructive influences of atmospheric oxygen and humidity. And then we have accurate drug dosing can be difficult due to low uh, weight, milligram and the microgram doses. So the active pharmaceutical ingredient can be degraded at the site of administration. For example, like what we have discussed earlier on, low pH in the stomach, which will promote the ionization of the drug. So API may cause local irritations or injury when they are present at high concentration at the site of administrations. And API can have unpleasant organoleptic qualities, such as taste and smell. Taste are so difficult to swallow, and the smell is so bad, and so forth. So we can have several dosage forms: um, tablet, capsule, liquid, cream, ointment, lotions, and possibly others form as well. Before you can create your medicine, you have your API, which is the active pharmaceutical ingredient that gives the effect, the therapeutic effect. But we will have to add it with other excipients. This is what we call the commercial formulation. Excipients plus the API will give the medicines that you want. So what is excipients? An excipient is a pharmacologically inactive substance formulated alongside the active pharmaceutical ingredient of a medication. So the purpose of excipients is it aids the manufacturing process to give it a good volume or weight. It protects, support, and enhance stability of our API. It is there for bioavailability or patient acceptability. It assists in product identification, so we can give it different shapes or different colors. It enhances the overall safety or functions of the product during storage or use. It provides bulk to the formulation. It facilitates drug absorptions or solubility and other pharmacokinetic consideration. An ideal properties of excipients should be number one, they don't interact with the drug, meaning it's stable, and they are pharmacologically inert. They are reproducible. They have desired functionality, and the cause is effective. However, in the recent years, excipients have proven to be anything but inert. So they do have some reaction as well. Importantly, they also cause some adverse and hypersensitivity reactions in patients. So the excipients that we choose must be really thorough and careful in order not to give a side bad reactions. So these are the common excipients used in tablet. You, if as you can see here, we have diluents, we have binders, we have disintegrants, glidants, lubricants, tablet coatings and films, and other coloring agents. So you have to have these. What are the functions again? I'll give you an easier one. For example, referring to these tablet coatings and films, protect tablet from environment such as light, air, and moisture. It increases the mechanical strength, mask the taste and the smell, and it helps us to swallow the medicines, and can be used to modify the release of active ingredient, may contain flavors and coloring. So for example, we can use sugar or this sucrose, but now has been replaced by film coating with natural or synthetic polymers. Polymers that are insoluble in acid, for example, cellulose acetate phthalate, are used for enteric coatings to delay release of active ingredient. So there are many other more. Common example of adverse reactions to excipients. Tartrazine, this is a coloring agent, and what it causes, some reports on hypersensitivity, hyperkinetic activity in the children. That's why we've seen some of the coloring agents have been banned in the production. We also have this aspartame, they call it, function as a sweetener, and cautions in patients with phenylketonuria. Lactose, this is functions as tablet filler, so it can cause in patients with galactosemia, glucose galactose malabsorption syndrome, or lactase deficiency, and many other. So in terms of the drug delivery system, what it is a process of administering drug, and must be carefully chosen to increase the chance of drugs to reach the sites of interest so that it achieves its maximal therapeutic benefit in human or in animal. So it involves technologies for the targeted delivery, um, or controlled release of therapeutic agents. The objective of the delivery is to promote therapeutic effects by number one, increasing its bioavailability. Number two, it's preventing toxic and harmful side effects, and as well as it's minimizing degradations or loss. And basically, there are three routes of the delivery. Normally, we have this application location, but can also be defined by its effect, whether it's local or systemic. So we have local, intraoral, and parenteral. What are the factors that we should consider when we select the delivery system? Number one, look at its physical-chemical properties. Look at what it means by that is that the half-life, the molecular size, the stability, and the loss of biological activity in the aqueous solutions. And we also have to consider the solubility in aqueous solutions, whether they are hydrophobic or hydrophilic. Hence, we have to look at the pH and pKa value, the temperature that it will be in, the concentration, the crystallinity, and the particle size. Then we are looking at the drug biological interactions, whether or not the drug is sensitive to first pass metabolism, low membrane permeability, enzyme degradation, bacterial degradations, and other side effects. The third factors is the desired pharmacological effect, whether you want it to be local, or systemic, or immediate response. And the fourth factors, or other factors, we also have to consider the effect of digestive juices and first pass metabolism of drug, accuracy of dosage required, and the condition of the patient, whether the patient is unconscious, conscious, vomiting or not. So this is the route when we administered it locally. It's two feces metabolized, and bioavailable to the body. Right, local routes, topical external application of the drug to the surface for localized actions, for example, lotions and cream. For deeper tissue, certain deep areas can be approached by syringe and needle. So, example, intra-articular um, injections or infiltrations. For arterial supply, a closed intra-arterial injection, for example, the angiography or the anti-cancer drug. For enteral routes, which is the desired effect is systemic and non-local. Substance is given via digestive tract or involved with gastrointestinal tract, oral or sublingual, and then rectal. Example, oral, sublingual, and rectal. For oral, we have disadvantage as well as some disadvantages. Self-medication possible, i.e. no help is needed. And then vast area of absorptions, simplicity of procedure, and slow in action and hence safe with some risky drug. Both solid and liquid dosage forms can be given. But in terms of the disadvantages is onset of action is tardy. Irritant and unpalatable drugs cannot be administered. Absorption is irregular with some drugs and may induce nausea and vomiting. Not useful if the patient is vomiting and having diarrhea. Can be destroyed by gastric juice. Yep, so this is the entry quoted. Why we quoted research is to do all this, prevent gastric irritation, have desired concentration, and whatnot. Control release, it's a time fuel or spent fuel to provide uniform medication for a long period of time. So that's a keyword there. And traditional oral delivery systems is all this. And then the sublingual, it's kept under the tongue or crushed and spread over the buccal mucosa. Advantage is rapid. Liver is bypass. Go straight to your systemic circulation. You can speed up the drug if you don't like it. And yeah, so the disadvantages is only lipid soluble drug. Uncooperative patients won't want to do that, and irritation of mucosa. So the drugs is, for example, that GTN or the buprenorphine. Traditional delivery system is tablet or chewing gum. In terms of the rectal, we have this animal advantages is first pass metabolism, useful for children, can be used in the presence of vomiting. Disadvantages is absorption depends on the disease state,